So get ready with everything. Yeah. So now this is a speaking session. Yeah, this is a speaking session here. Now, how can we program this session? How can we program this session or plan for this session? Think about all your options. Yeah. So now, what are the components here based on this one? What do you think you have to plan for? What do you think you have to plan for? This is a setting we should know. Now, before we start the role play, what are the things that we should know? Okay, what are the components that we know? So here you can see. So confirm the reason. So confirm the reason. What is the first thing? You should know the background. You should know the background. This is the background. Okay. This is the background. The patient is 60 years old. He has type 2 diabetes and he has been moderately well controlled by diet and oral medication until now. However, recently the patient's blood sugar have been high. The patient's blood sugars have been high. Now just let us observe this one. And then the doctor has decided to commence insulin injections. So operate modus operandi, we say. So the procedure changed, modification, medication modification. So you are seeing the patient to show him or her how to administer injections. How to administer injections. This is the background. You should know these points. Now, first of all, the first one is, so what is the setting? This is the setting. This is the setting. Right. It's a medical clinic. It's a medical clinic. And the next one is the background. The next one is the background. What is the background of the patient? The story behind. So this is the background of the patient. So the patient is 60 years old. That means you will know about the age of the patient. Next, the patient has a type 2 diabetes. The patient has a type 2 diabetes. So that means you will know about the medical condition, existing medical condition, which has been moderately well controlled by diet and oral medication until now. So till now, he has been able to control by two modes. One is a diet and oral medication. Diet and oral medication. You can see that there. But, however, means but. So what's this? So in spite of that one, there is some sort of problem. So that problem is persisting. That problem is persisting. Now, there's a change. There's a change. Despite or in spite of, although, though, even though, or but, or yet. So you can use these things. These are contrasting situations. Earlier, he has been managing well, but, however, there is. Now, there's a change. Before and now onwards. Before now and after now, or from now onwards. So there is a twist, there is a change, something different. So before that was enough, that was sufficient, excellently managed, well controlled. Everything is fine, going on fine. But now there is some problem. A problem has arisen. Some condition, is not very fine now. So the doctor recommended something different plan. So there's a change in the plan. Earlier medication and diabetes diet, but now that is not ample, that is not sufficient, that's not enough. So the doctor is changing the treatment plan. Now this oral medication will not suffice. Therefore, commencement of insulin injections or self-injecting insulin is advised, recommended. So earlier oral medication was enough, but now, because that is not going to help anymore, the condition is deteriorating, is not the same anymore. So the doctor recommended insulin injections. So now these insulin injections cannot be taken, through a nurse every time, every day. So he cannot come to the hospital every day, and the nurse cannot go to him personally every day. So this is going to be regular, routine. It should become a daily habit on a daily basis. So either the patient going to the hospital or to the nurse every day, or the nurse going to the patient every day, both is a little bit, strenuous, difficult, complicated. So administering insulin injections by the nurse on a daily basis is a little bit difficult. It's impossible. Will not happen every day. So now the nurse is going to explain. So the setting is the medical clinic. The nurse is in the medical clinic. The patient has come to the medical clinic. and the doctor has advised or instructed the nurse to give training so that the patient can take insulin injections on his own. The term is self-injecting insulin. Self-injecting. That means the patient has to learn the art, the skill of taking injections without anyone's assistance or help. Because every day somebody will not be there. For example, if it is a child, that's a different thing. Or a very old woman, feeble, fragile, or a very weak person. So this 60-year-old patient is strong enough. He can do it on his own. Yeah. Above 75 or 80 or 90, then it will be difficult. Or below 15 or 16 or 18 children, it will be difficult. Okay. It will be very difficult. So what you have to do is, what you have to do is, now you have to train the patient. You have to train the patient. Okay. So Dr. Sunil, yeah, there is one Dr. Sunil, a trainer. Is that a trainer or is that a doctor? Yeah, fine. So now here, you have to explain the patient and make him master the skill of taking injection without anyone's support. He need not go to the clinic. The nurse need not go to the patient every day. So this is very hazardous, difficult, complicated. So if you train the patient, he need not depend on anybody. He will be independent. He can do it on a daily basis at his convenience, at his own residence. That's the point. So this forms the background of the role play. So you know everything about the patient now. The patient is new. His condition is old. Patient is new. Now you are going to train. All these things you are capable of. You have to explain or demonstrate or assist or support in this case. Now, first of all, the end result, the ultimate goal is that the patient should say, yes, nurse, now I can do it all by myself. So that's what it is. So instead of you giving the injection, you train the person to take on his own. That's the point here. So from the next day onwards, or at the earliest, he can do it excellently without any support. That's the point. Now here you have 5 subtasks. The task is training the patient regarding self-injecting insulin. This is the task. And you have 5 subtasks here. The first one, you see the bullet points. The bullet points. Number 1. This is number 1. Yeah. That is number 1. Confirm the reason for appointment. So confirm the reason for appointment. So how do you confirm? You will confirm whether the person is right or not. How will you confirm whether the person is right or not? By asking his name, his date of birth, or whatever it is, and his case. So this is the initiation. This is the initiation. So the commencement or the beginning of beginnings. So this is a curtain raiser. We call it curtain raiser. It's a curtain raiser. You are going to initiate the role play. Initiate the role play. So first one is the curtain raiser, and the last one is the closure, curtain dropping. Okay, that's the end. So here you will ask like this: before we commence the actual discussion, would you mind providing me some basic details? For instance, your name, your age, and the reason for your visit. Okay, the reason for your visit. So this is how you're going to introduce. And before that, you will introduce yourself also. So he'll come and you'll talk to him. Welcome. Please have your seat. Let me introduce myself to you. My name is the interlocutor Grandmaster Peter Simon. I am going to discuss with you regarding your problem. But before we commence our actual discussion, can you please provide me some essential basic details? For instance, your name, age, and the purpose of your visit to this medical clinic today, in order to confirm. Yeah. So this is the way how you can talk in the beginning. Then he will tell you, now you confirm that he is regarding self-injecting insulin, and he will tell what is his problem, and he'll discuss some of his background things. Then, okay, you can find out how the patient feels about insulin injections. Yeah. The doctor has arranged this meeting because he wants me to train you to self-inject insulin so that you can do it on your own at your residence on a daily basis. So what do you feel about this change in the treatment plan? What is your opinion regarding self-injecting insulin? What do you think about this transition from medications, oral medications, to self-injecting insulin? What are your concerns? And what is your opinion? So you can talk in number of ways. You can talk in number of ways. Right. So this is how you are going to find out whether the person is right. The person who is right in front of you is the correct person, or is it a mistake that he is with you? And the patient, so you have the case role play here, the case sheet with you. So you will confirm that you are not going to waste your 5 minutes of time with the patient. Okay. Afterwards, feeling sorry for it. So now here it's very clear onset. Now, next one, second point is exploring the reasons. Exploring the reasons for the pain. You asked him, how do you feel about self-injecting insulin? So, how do you feel about insulin injections? What do you think about self-injecting insulin? Or what do you consider this transition as? Right. So once you tell, he will say, oh, nurse, I have been managing well for this 3.5 years or almost 4 years. I'm doing well with everything. What is the reason for this change or modification in my treatment plan? Everything is going perfectly well, right? All of a sudden, why this transition? Why this change? Why this alteration in my treatment plan? So that is what he's asked. And to tell you frankly, I'm scared of injections. I'm scared of needles. I have a fear. I hate taking injections. I'm afraid I cannot. It's almost impossible. How is it possible, nurse? So, if I need some injections, I'll go to the nurse. And now you are telling me to learn this and do it on my own. How is that possible? So he will give his, fear or anxiety reasons. Now you have to explore why. Why do you think you're afraid? What makes you afraid? Is it taking it on your own, or is it the needles and syringes, or is it the fear of pain, or is it the injecting process? What exactly is the reason for your fear? Why are you afraid of taking injections on your? Can you explain in your own words so that I can understand and brief you and explain you further? Okay, so that I can clarify your doubts. Tell me everything. So you are going to find out the reasons why he is afraid. Then he will tell the reasons. Yes, nurse, I have a lot of fear. I have fear. Since childhood, I have rarely taken injection, maybe 2 or 3 instances. I'll avoid taking injections as far as possible. So I'm a little scared. And I'm not a nurse. How can I take injection? First of all, I don't want to take injections only because I'm afraid. I'm afraid of sharp objects piercing my skin. So I don't want to take these injections. I think I can come to you and take if possible. So then you will start reassuring the patient. So first one is the first point, the second point, and this is the third point now, third bullet point now. So you are going to reassure the patient. The third point is you are going to reassure the patient. Okay, reassure the patient. How are you going to reassure the patient? I absolutely and no. Don't say like that. First, listen to him very carefully. Listen to him very carefully and try to understand his feelings. Try to agree with him. Don't object. Don't contradict. Don't object. Don't contradict. Don't say anything against his feelings. Be on his side. Gain his will and try to comfort him in the first place. That is what reassurance. He's worried. You have to make him comfortable. How are you going to reassure him? You have to reassure him in 3 different stages. First thing is, don't be in the opposite side of the court. Partner with him. Befriend him. Gain his affection. He should feel that you are his friend, supporter. Okay? You are on his side. He should feel that. If you say, no, nothing like that, then he will feel that anything negative to his words, he will not be ready to listen. So first thing is that from that negative side, bring him to the neutral side. How can you bring him to the neutral side? That means no fear. First, fear to no fear. Anxiety to zero anxiety. So now you have to bring him to neutral stage. You have to bring him to the neutral stage. So you have to talk as if you are his friend or a relative or a close person or well-wisher or his teammate. Like that you have to do. Of course, I absolutely understand your concern. Your anxiety is reasonable. If I were in your place, I would have also reacted in the similar way. Many individuals, if they are in your condition and in your situation, they will also be anxious and worried. So it is quite common for any individual to be tensed or upset or afraid to change the treatment plan from diabetes diet and medications, oral medications, to self-injecting insulin. Many of my patients also were anxious. So no need to be worried. Just relax. Now, so now you brought him to neutral. You gave many examples. I gave many sentences. It doesn't mean that you speak all these sentences. 1 or 2 you can use. I have given you many different variants or varieties or styles. So you have brought from negative side to neutral. From neutral, you have to go to the positive now. So now you have brought him to the neutral. This is phase one. Okay, phase one. You have partnered with him now. You have become his well-wisher now. Now he will listen to whatever you say because you gained his heart. You are ready to understand him. You are ready to support him. He will feel like that. He will feel like that. So that's very, very important. Gaining the love, heart, and his, will is very, very important. Once you go to his side, he will be ready to listen to you now. Now you tell anything, he will listen to you. Instead of that, you will start with a sentence, no, 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 that is not right. Okay, why are you worried? So if you question like this, he will not be ready to listen to you. First, you listen to him, and then he will listen to you. Even a small child also. Don't go against them because they will never listen to you afterwards. First, listen to them patiently. Then they will be ready to listen to you because you gave him your ears and ready to listen. So that's why he will listen to you from now onwards. So once he comes to the neutral, he will be ready to listen to you. Now give some more examples. So you can give your own example. You can give an example of your relative, or you can give your example of other patients whom you have treated. Anything you can say. My mother-in-law, my mother, my aunt, my nephew, my niece, my brother, my sister, my father, my grandfather. So take any example. Okay. Is also a diabetes patient. But he has been able to manage his condition for the last 15 years. Now, he is able to manage very excellently. There is no problem at all. I am a nurse. I am with my grandfather. But he doesn't depend on me anymore. Initially, maybe for a week or so, I supported him. But afterwards, my duty is a shift system. So every day, I may not be available. So he started self-injecting. He doesn't bother now. In my experience as a nurse for the last 15 years, I have trained a number of diabetics. Initially, they were scared, but now they are comfortable. Everything is going on well. The only difference is they are taking the injections on their own. A number of patients, hundreds of them, I know. Because sometimes they return to the clinic for some other reason and they discuss with me about their condition. So, if all these people can manage their condition so efficiently, why not you? You can definitely do it on your own. If need arises, I can be with you for 3 or 4 days. Either you come here or I come there to your place. So until you are confident, I'll support you. But I don't think that is necessary. You'll do it on your own today. I will be just guiding you every step, step by step, from the very beginning to the ending. And you will do everything on your own, all by yourself, right today. I will be guiding you, and you will be doing everything slowly and gradually. Will take time to learn. By the end of this episode, the very first, you'll realize how simple, easy, and efficiently and efficient, how easy it is and how simple it is. And by the end, you'll realize how efficiently you can self-inject insulin. In case you're not confident, you can come for another 2 or 3 days. If need arises, so no need to worry. Okay. So this is all about reassurance. Now you are making him confident. First stage of reassurance, first stage of reassurance is removal of anxiety. And the second stage of reassurance is building up confidence by citing examples. And third stage of reassurance is the real procedure. You will be there. Yes. Now take the cotton swab and wipe, clean the area where you are injecting. Yes, you have done it perfectly well. That's what it is. This is the first step. You have done well. Now let us move on to the second step. Now take this injection, take this syringe, okay, and take this needle, insert the needle or fix the needle to the syringe like this. So you will guide him. Yes, that's what it is. Now take the syringe into your hand. Now place this needle. Yeah, pick the needle with your own hands and insert or fix the needle perfectly tight. That's good. You have fixed it properly. Now pull the plunger. Okay. Yes. Now push it back. This is how you pull the plunger of the syringe. Now it's filled with air. Now push it back. Now take the vial and break it open. And then insert the needle. Okay. Into the wire in a slanting position and pull the plunger again, drawing the insulin, and mind you, to the level which is suggested by the doctor. How many milliliters? It's marked there. That is the limit. Yes. A little more. Yeah, now it is right. Neither less nor more. The perfect amount should be drawn into the syringe. So this is how step by step you will guide him. Okay. No need to explain everything as far as possible. Take 2 points out of everything. I'm telling you this much you can do. But from them, 2 sentences can't you take? Any 2 sentences from each one. Next one, importance of insulin injections. Stress the importance. If you are afraid, that's not going to help you anyway. Insulin injections are very important. You know the reason why? Do you know the reason? I'm going to explain you. I'm going to tell you now. Your body, the condition is not going to be managed efficiently anymore from now onwards with the oral medication. The condition has deteriorated, and therefore it is mandatory, it is very essential for you to take insulin injections. After considering every other alternative treatment plans, the doctor has finally decided to commence insulin injections because this is the only best treatment method for your condition now. So the way how you are going to, squeeze the juice out of the lemon perfectly. So you have to tell him, it's not a warning, but you are educating him the reality of the situation of the patient in the current times. This is the only possible method to manage your present condition. This will help you in faster absorption into the bloodstream. Yes. And it's not broken down in stomach. Like how the medication, when you eat, it's broken down in the stomach. Okay. And it is more effective. And there are many other benefits. Right. So, initially, you will have this fear, but gradually, within a week or so, you will perfect your self-injecting. And you'll become an expert. Right. This is how you will increase his confidence, boost his confidence level. Next one. The 4th point is this. This is the 4th point. Yeah. Now let us see. Emphasize injections are the best possible option. Current management not working. Explain. Injection giving process, washing and drying hands, pinching skin, insertion of the needle, 45 to 90-degree angle, leaving in place 5 to 10 seconds, etc. Describe need to rotate injection site, prevent formation of lumps. Okay. Yeah. So, describe need to rotate. Okay. Then next one, lumps, risk of less insulin injection, insulin absorption. Now here, insulin giving process, straight from washing and drying hands, pinching skin, inserting needle, 45 to 90 degree and leaving it there. Okay. And then you have to describe rotate injection site. There are 5 injection sites. The left and the right shoulders, the left and the right inner thigh region. Okay. Inner region of the left and right thighs. And then the area surrounding the umbilical cord. Okay. So these are the 5 sites. The best site is the area around the umbilical cord. Okay, the belly button. So these are the 5. So you have to rotate it better in a clockwise direction. Start with your left, left shoulder, left thigh, right shoulder, and then the area around the belly button. And then you can repeat the same way and make a note in your diary every day so that you may not forget or re-inject on the same location. Make it a practice in your diary. So if you inject on the same side repeatedly, the result may be bruising, or bruises, or lump formation, or itching, or irritation, or anything like that. And one more thing is, okay, you can take a new disposable syringe and needle every day. That's 100% better and safer. If you are using the same glass syringes on a daily basis, you can just wash it in, okay, boiling water, okay, for some time, and then you can reuse. But it's better disposable ones. So you can talk about everything like that. So from every point, if you take 2-3 sentences, that's enough. Now explain the importance of safe needle disposal. So this is after injection. What you have to do over there? Used needles and syringes. What should you do with the used needles and syringes? Okay. Oof. So what are you supposed to do with these used needles and syringes? Okay. Right. Explain the importance of safe needle. Now, finally, before we conclude our discussion, let me tell you about safe needle disposal or sharp disposal of the sharps. Sorry. It's very important to dispose the needles and other sharps. Now, this is a blue bottle, container. I'm going to give this to you. And after using the needles and the vials, the glass pieces, or whatever, you have to dispose them straight into this container. To avoid any accidents, for example, children or other people, if they by mistake, they may get hurt or bruising or cuts. To avoid such unwanted or unnecessary accidents, it is better to drop your used needles, glass pieces, and used vials into this container, and immediately close the container with a lid. So this is what you say. And then that is regarding safe disposal. The next one, storage of insulin. Unopened insulin vials or yes. So these things should be stored in the refrigerator and maintain the standard temperature. You should not keep them out. You should remove only when you need them, and all the others should be stored. And then you should not expose them to sunlight under any circumstances, because it will nullify or diminish or deteriorate the advantages or the impact of the medication. You have to check the expiry dates or expiration dates, and you are not supposed to take the insulin which has crossed the expiry date. Whenever you are taking the insulin, mind you, for 1 second, check the expiration date. And after confirming that the insulin is valid and it is within the expiry conditions, okay, it's not expired, then you can take it. Make sure. Then, now see, this is how you are going to. Now, are you ready to self-injecting insulin? So, now you will take his willingness to be observed or to self-inject on his own, right? So you can demonstrate it first to somebody else, if anybody is there, or you can ask him to come at a time when you are giving insulin injection to somebody, and you can ask him to watch how you are giving them, and then you can ask him to take on his own. Okay, so you can take all the plan yourself, plan very effectively. So that's it. So give your feedback regarding this particular session. Whether it is a nurse or it's a doctor, it doesn't matter. The subject is the same, the grammar is the same, only the card is different and the role is different. Otherwise, everything is the same, even the doctor, okay, or a pharmacist or a nurse. Yeah, the grammar is same, the vocabulary is same, the pronunciation is same, the sentences are same, the reassurance is same, the initiation is there in the conclusion. So now give your feedback, please. How beneficial was the session? I'm giving you 1 minute for your feedback. So in the meantime, I'll call some students and you can respond. First, let us talk with Dr. Muhammad. Hello, Dr. Muhammad. You can unmute.
Hello.
Hello, Dr. Muhammad. Can you share your experience of this particular role play session, which I have explained, how far it was beneficial for you?
Yeah, actually, it's very good and very beneficial. So you came across the setting and the background, and you went through all the points we have to discuss with the patient, and you explain. Actually, it's very good session.
Yeah, thank you very much. Sudha Rani. Sudha Rani, if you're comfortable, you can share your experience. Are you okay, Sudha Rani? You can unmute and you can speak. Next, Tandeka. Tandeka. Yeah. Then Jeniba.
Good evening, sir.
Good evening, Jeniba.
Overall, the session was very useful, sir. First, the location, how we have to identify, and from that, you have listed everything down, like the reason for the visit. Then the bullet points we can take as a keynote to ask questions, and we should not, always we have to be with the patient. Like we shouldn't be very negative to them. We should bring them to the neutral point. So those things are very useful because that will give us a good marks in the exam time. So overall, it was very beneficial, sir. Thank you so much.
Yeah, that's good. That's good. New batch is starting this Monday because tomorrow students are going. So if anybody is interested, you can contact me. So that's fine. So we'll meet the next day. So all the regular students can attend the regular sessions, no doubt. Okay, and from Monday, yeah, today I'm giving some special discount for new students, right? So if anybody is interested, you can contact me after the session. Anybody who is watching the YouTube video or who is watching this Zoom session, attending this Zoom session, you can contact me. Those who are interested, so you'll get some discount today. Personally, you can contact me, then I will tell you. So that's the end of the session. Have a nice